Hello, everyone. Welcome again to the Stanford Health Policy Forum. My name is Keith Humphreys. I'm a professor of psychiatry here at the medical school, and I chair the advisory group for this series, which also includes Drs. Dan Kessler, Mary Goldstein, Doug Owens, Rob Kocher, and Ann Arvin. We hold these events several times a year, looking at health policy issues that are extremely important and about which intelligent and reasonable people can disagree. And we've got some very intelligent, very reasonable people here to discuss this today. I think it's going to be a terrific event. Before I introduce the panel, I just want to say we could not do these events without the extraordinary support of the Dean's Office and our Dean, Dr. Lloyd Minor, who's here today to open up our proceedings. So, Lloyd?
Well, Keith, thank you very much, and thank you all for being here. Keith will be back up in just a moment to introduce our distinguished panelists today. In choosing this topic, when I was informed about the topic and about the speakers, and I've had the opportunity through working closely with Rob Jackler and learning about the wonderful work that he's doing, looking at the effect of advertising for tobacco products. So I've had an opportunity to really learn the status of the debate today regarding tobacco in general and e-cigarettes specifically. I think this topic of e-cigarettes demonstrates a dilemma that comes up not infrequently in public health. And we've seen it in other areas in public health. Certainly, and one of our panelists is from Johns Hopkins, but there were a few years ago, some very spirited debates about studies that were being done on how to get lead out of the household. The Baltimore community and a lot of older households is coated with lead paint. Now, you might say just tear down everything and rebuild it from scratch, but economically, that's not something that's feasible. So what can be done short of what would be a total fix? In fact, in some cases, you'd even have to dig up the yards because the lead paint is in the grass and in the soil. So short of that, what could be done to reduce the risk of lead poisoning? And then certainly in global health, we have dilemmas over antiretroviral therapy. And yes, it would be ideal if the latest antiretroviral therapy were available, as it is in the United States, were available around the world. And yet, if it's not, because of economic factors or other factors, what could be effective and what studies could be done to establish the most effective treatments that still fall within the opportunities of the time, at least as they're economically determined. Now, the e-cigarette debate is a bit different. I think everyone in this room, or I hope everyone in this room, would agree that the world would be a much better place if we eradicated tobacco entirely. If we had a magic wand, we pull out our magic wand and could get rid of tobacco entirely. I hope no one would disagree that that would be obviously something that would make the world a much better place and a much healthier place. Recognizing that that is not likely to occur in our lifetimes, or we can aspire for it and make incremental progress towards it, maybe even make grand leaps towards it. But how do we deal then with nicotine addiction in the best way possible to reduce the usage of the most dangerous nicotine and tobacco products? And that's going to be the core of the debate I think we hear today. Are e-cigarettes providing an opportunity for a safer, still with some clear health consequences, but a safer alternative to smoking tobacco in terms of getting people to reduce cigarette smoking? Or are they actually introducing a new generation of addiction to nicotine through the delivery mechanism of the e-cigarette? And how do we trade off and evaluate those dilemmas? I think those will be some of the issues that our panelists help us consider today. Thank you very much for being here, and I'm going to turn it back over to Keith Humphreys, who will introduce each of our distinguished panelists.
Thanks so much, Lloyd. And let me now introduce the people we have who've graciously agreed to devote their time to this topic today. Starting on your right is Dr. Rob Jackler. Rob is the head of otolaryngology and head and neck surgery here at Stanford. He's also the head of SHREDA, which is the Stanford Research Institute on Tobacco Advertising, which you can find at tobacco.stanford.edu. Do I have that right? Which is an incredible compendium of how the tobacco industry has pushed their product over the years. I encourage you, any day you're interested in losing all faith in corporate ethics, to look at that site. It's amazing. Then right next to Rob is Dr. David Abrams, who we're grateful he's traveled here from Baltimore. David is the executive director of the Schroeder Institute on Tobacco Research and Policy Studies. He's also a professor at the Bloomberg School of Public Health at Johns Hopkins, as well as also being involved in the Department of Oncology at Georgetown Medical Center. Grateful that you would come, David. And then next to David is Bonnie Halpern-Felcher. I speak for Legions of the medical school when I say how happy we are. She came down to join us last year to be a professor of pediatrics. She's a developmental psychologist internationally known for her work on health decision-making and risk behavior, including how adolescents make decisions about tobacco use. And then last but not least is our usual host, Paul Costello. Paul is the head of media and communications with Stanford. He came here after a very long and successful career working as a spokesperson for people in political office, and has been here for a good long time, and we're very glad to have him. So we will turn this over to the group. The way we do these things is the conversation goes on up to about the turn of the hour, and then we will open up to your comments, questions, and reactions. Just one word of advance notice. This is broadcast onto the internet. So in the comment question period, we're always happy to hear your general remarks. But if you have a personal medical question, just remember this is not a private forum. Okay, so thanks very much, and please take it away.
Thank you. Thank you, Keith. Thank you, Dean Miner. And thank you for joining us today. I just saw a headline on Huffington Post. Bacon and sausage as big a cancer threat as cigarette claims WHO. So maybe the next one we'll be having is e-bacon conversation. So I wanted to begin with, the Dean talked about this great divide, this great debate that's taking place within the public health community today. And part of that was played out in a letter to WHO, the head of WHO, Margaret Chan. And one group, which David Abrams was a part of, said e-cigarettes are part of the solution to reducing the ravages from smoking and should not be overregulated. The letter concluded by stating, these products could be among the most significant health innovations of the 21st century, perhaps saving hundreds of millions of lives. The second group, whose signatories included Rob Jackler and Bonnie, rebuted that letter and called for stronger regulation of e-cigarettes and said the evidence is insufficient to accept the assertions that electronic nicotine delivery systems, which are known as ENDS, are effective as a smoking cessation device. Public health authorities, the letter concluded, should not buy into tobacco industry's well-documented strategy of presenting itself, quote, as a partner, end quote, in reducing the harm caused by tobacco use. So I think that really presents part of the heart of this debate. So let's start with those dueling letters. What do you think the other side has right, and what do you think they have wrong? David.
So, I think, as was said, we all agree, and particularly the Truth Initiative, which is the new name of the Legacy Foundation, that no tobacco or nicotine delivery system, regardless of its level of harm, should be used by kids, we think, under 21, and should be marketed or done in a way that appeals to kids. I think that letter does emphasize that, but also says there is an enormous opportunity for anybody using combustible tobacco where the deadly smoke is well documented from the combustion product, that when you decouple nicotine from the combustion, the harms of nicotine delivered in alternative systems is substantially less than it is for combusted tobacco. So the letter that I think gets right is keep it away from kids and double down on that, especially even do better with keeping combustibles and other smokeless tobacco away from kids. We don't do a perfect job on any of those, and use everything we know to do that. I agree with that part of the letter. Where I disagree, and I think actually the evidence is mounting quite nicely, particularly from the UK, with the latest Public Health England review, that e-cigarettes have and can help millions quit smoking, or at least switch to a much safer form of nicotine delivery that's satisfying enough to compete with the cigarette. And that's why I think we have some dilemma here. It's not an either-or, it's a both-and. How can we use harm minimization to complement and add to what we already do in tobacco control? Not to conflict with it, but to speed the demise of the combustible cigarette, which overwhelmingly accounts for the death and disease, and we're just going too slow with conventional status quo approaches.
Rob and Bonnie, what does the other side get right and what don't they get? What do they get wrong?
If I could preface with your comment about WHO and smoked meats, if you look in the 7,000 e-cigarette ads on the Srita site, you will find that there is bacon-flavored e-juice. And we found that in an interesting way, is that Lori and I were at Technion in Haifa, Israel, and I decided I would look and see if there was kosher e-juice, and there is, and I had to see if there was decidedly non-kosher e-juice to go with it. So to give perspective on this, I think it's true that across all of public health, there is a passionate interest in the health and well-being of our young and compassion for smokers. We're not against smokers. We care deeply about smokers and would like to bring help to them. There is, however, a spectrum of opinion, which I think is healthy and dynamic, from one end saying that e-cigarettes are re-normalizing smoking behavior and therefore popularizing it and making something that long-held efforts to make it unpopular and socially less acceptable are making it now socially acceptable. Therefore, it's dangerous and it should be prohibited. The other end says it has enormous promise, which it does, but the data, as we'll get into, is quite ambiguous about whether or not young teens begin with e-cigarettes and then graduate to combustible or other products with harm, and whether or not the 2-pack-a-day Marlboro smoker who picks up e-cigarettes is more likely to quit or less likely to quit. And if so, by what quantity? Neither of those two areas are yet supported by convincing evidence-based, no matter how hard you look at the data. And you can, so it's basically whether you're more worried about the devil that is, or you're hopeful that there is a miracle solution. And there's a long history to harm reduction and safer cigarettes. People who have been around a long time are worried about the history of filters. So filters were supposed to protect the public. The tobacco industry proffered filters as safer, that more doctors recommend this product, and of course it was not true. So I think a lot of people are colored by the concern of the tobacco industry itself, championing something to reclaim lapsed smokers and to reassure a worried group of youths that it's actually okay to resume smoking behavior and all of its associations, because in fact it's not so harmful to you.
Bonnie, what do you think they get right?
So I think, and I agree with a lot of things that were said, I think what's important to think about here is, on one side, like Rob said, we've got the continuum of worry about whether people who are adults who are smoking and smoking regularly really will completely stop smoking cigarettes and go on to e-cigarettes and then hopefully eventually leave that. If that were the case in the ideal world, I would stop there and be happy, because that harm reduction, although we still don't know enough about e-cigarettes to say whether they are completely less harmful, but at least I would buy that argument much more so as a harm reduction argument. My worry is twofold in terms of letter. One is, as Rob said, the youth, that you really cannot look at the adult user model without considering the adolescents who really are striving to be like an adult, and that using that as the social renormalization and sort of the role model of use. And so we cannot look at the adults without also looking at the kids. And I think the letters, particularly the initial one that looks more at the harm reduction, isn't taking into account enough of the adolescent perspective. But the other piece also in the letters comes down to regulation. And my feeling is, and what the other letter is saying, and the second letter is, regardless of this harm reduction approach, we still need to regulate this product. regardless, even for adults, there's so much going on in this product or these products, because it's really not just one. There are many different types of what we call electronic cigarettes. I don't tend to call them ends because I don't think they're the end. But in e-cigarettes or electronic cigarettes, there's so many different types that we also need to regulate the product and what's going into them, even for adults. So I think that's the other difference that happens in that letter.
The FDA has been struggling with, perhaps is the word, with regulations, with taking a look at regulations now for several years, maybe even as long as 6 years. And recently, Matt Myers, the president of the Campaign for Tobacco-Free Kids, said that the FDA's inaction should be pilloried. Why the delay? I'm perplexed. The Obama administration, e-cigarettes, it seems to be something that the administration would take some quick action on. Why the delay of many years? David, what do you think's happening there?
Well, you know, I think some of this is the often understandable slow movement of any government agency. I think it is unfortunate because we've got a lot of work to do, and I agree we need to regulate all these products. And in fact, regulate them, I think, with a very light touch and with rapid approval so that the dramatically less harmful e-cigarettes are made even less harmful and of high quality, that all consumers could be confident of that. I do think the evidence is very solid that they are dramatically less harmful than cigarettes, especially in cancer and probably also in heart disease and COPD, because they absolutely have very low, almost non-detectable levels or trace amounts of the top 8 carcinogens that are found in cigarette smoke, and they have no carbon monoxide. And so logic and recent studies, particularly by Steve Hecht, one of the world leaders in Minnesota, make it very clear that they're dramatically less harmful than cigarettes. So I think regulation with a light touch, the way the UK is doing it, would both protect users who can switch completely and therefore dramatically save lives, while keeping it out of the hands of kids, regulating advertising and marketing to kids so that it's directed at adult smokers. The other thing that I think is a problem here is the world has changed. When the world switched from flat to round, you have to change your navigation instruments. And I think it's wrong to think of e-cigarettes the way we thought about the 1960s low tar, low nicotine, and the grossly misleading statements of the big tobacco industries, which I still am worried about here, particularly that they've gotten into this market. However, there are other companies that are not owned by big tobacco who could, in fact, put combustibles out of business faster. And I worry about the public health community as well, because to the degree that we overly scare the public with misleading or exaggerated science about the harms of e-cigarettes, and even the harms of nicotine, which are not harmless and certainly should be kept away from kids. But if you over-dramatize that, we're actually seeing smokers who quit and switched going back to cigarettes and being less motivated. So you're feeding into big tobacco's idea of dual use and keeping combustibles going for a very long time, to the degree that we over-demonize e-cigarettes and don't find that balance, thread that moving needle very carefully to minimize impact on youth, but maximize benefits for anybody moving into smoking. And by the way, that includes 5.6 million of all our children alive today, including my grandchildren, who, if we don't do more, will still become lethal cigarette smokers when they grow up. And so this is huge, to deter and displace cigarettes in a balanced way and keep it out of the hands of kids, and see that this is not a wolf in sheep's clothing the way big tobacco misrepresented low tar, low nicotine, which I agree with. This is a sheep in wolf's clothing, and we are making it a wolf in sheep's clothing, and the public are losing.
So let me ask Bonnie and Rob, is this a sheep in wolf's clothing, and is the light touch that David talked about the way to look at regulation? Rob, I know you wanted to jump in on something else.
Yeah, well, there are about 3 things I think we should look at thoroughly. One is cessation of adult smokers. The other is youth initiation. But I wanted to talk upon the healthfulness of e-cigarettes. And there's no question, if you're a 2-pack-a-day Marlboro smoker and you change to e-cigarettes, it is probably a very beneficial thing for your health. However, let me point out something, is that you're breathing in and out propylene glycol and glycerin and coating your small bronchi, your bronchioli, your alveoli with that every day. Let me point out that you can smoke for many years before you get chronic obstructive lung disease. You can, it takes decades, literally. We have almost no experience with chronic use of these vapor products. It isn't necessarily inherently the case that these vapor products will not harm the lung. Let me give you one example. The flavorant industry manufacturing places are actually very dangerous places because the flavoring chemicals, aldehydes, ketones, and extracts, they may be safe as taken in the GI tract. But the toxicity profile of the lung and the damage to the lung, we're now sticking all of these, the entire library, there are thousands literally of flavors of e-juices, which are basically bought from flavorant companies. They're potent chemicals. They were never designed for exposure to the lung. And you're breathing this in over and over. And I'll use the example of diacetyl in popcorn lung. So we know that microwave butter-flavored popcorn, those manufacturing plants lead to obstructive lung disease, right? And they do over relatively short periods of time by workers there. We're mixing in diacetyl compounds, heating them and vaporizing them, and the heat alters them and makes them more toxic. And these kids can start at a young age deeply breathing these chemicals in the lungs on a daily basis. So while I agree, basically, David, that they are safer, the presumption that they're safe for a teenager to adopt as opposed to combustible tobacco, we won't know for decades. And we're experimenting with the lungs of teens potentially. I worry particularly about the flavorant compounds. Although the concentrations are less, I would very much like to see flavorant compounds go away. And that you not be able to get a gummy bear flavored or peanut butter flavored e-cigarette. And this is something regulation, sadly, you talk about the FDA, I think the current set of so-called deeming regulations are tepid. You mentioned what's the problem with them being delayed? The problem is there's a generation of kids today. It's going 3 times over in the last year, right? A huge growth in the number of young children picking these up. They're nicotine rich often, and they're becoming addicted as a gateway to, and many of them then graduate from e-cigarettes into smoking. Now, it is true that those studies show an association, not necessarily causation, that some of these kids who initiate with electronic cigarettes may well have become smokers anyway. But there are clear studies now that have shown, one particularly out of USC, that if you look at a large group of 9th graders at the beginning of 9th grade, by 10th grade, those that are vaping and have experimented with vaping are 6 to 8 times more likely to develop use of combustible tobacco. Now, whether they would have otherwise, I take that point. It's not a causation argument.
And the
it's
researchers
association.
really didn't know why they picked up cigarettes.
That's right. But still, there is that association, and that association spans many studies published in the last 2 years showing that there's a concomitant use of electronic cigarettes and combustible tobacco, and for that matter also hookahs and oral tobacco in middle school and high school kids. And that's troubling. We don't yet know its meaning. And I will say, to be fair, there's been a concomitant decrease in the number of students by 3.5%. Fewer middle school students and high school students are picking up cigarettes. That's great. What we don't know is all of those extra 5.5% of kids picking up e-cigarettes will over the coming years pick up smoking as well because of their addiction. And the final point making is that there's a substantial gain in aggregate of teens that are actually using nicotinated products compared to before because of the boost in e-cigarettes.
Bonnie, you had some recent research specifically about the gap in knowledge between what kids know about cigarette smoking and e-cigarettes and marijuana, and a huge gap between that. Can you talk about that and what you recommend for the public health community?
Sure, no, very much. And we have continued research going on that I can speak to as well, some preliminary analyses that we've done. So we recently published a study, a qualitative study, looking at adolescents' perceptions of electronic cigarettes and marijuana. And basically, adolescents in general are very much aware of the harms of cigarettes, and the social norms have changed in the right direction in terms of cigarettes. They're well aware of their harm. They really don't want to use them. When it came to electronic cigarettes, many people actually knew very little about the harms, were very confused about the harms, and really thought that they were beneficial, and partly because mom and dad were using it to try to quit smoking. But the message translated to the young people is, therefore they're healthy for me to go ahead and start using. And part of the problem is that we are, as a public health community, not saying much at all about the harms or anything around e-cigarettes. So it looks like we are saying that they're okay by basically remaining silent, whereas we have a lot out there about cigarettes. And so you sort of see this bifurcation of no information out there, except for a few people who are using it, who are thinking it's great, is translating to youth thinking that it's okay to use. And we have some other studies. We have a large longitudinal study, not as large as USC's, but a large longitudinal study of looking at adolescents' use and their attitudes towards these various products. And adolescents not only think that e-cigarettes are less harmful, and yes, to some extent, if you're comparing it to a very heavy smoker, they are, but they think that relative to not using at all, they're less harmful, so compared to cigarettes. So they're really seeing e-cigarettes not just as against cigarettes, but as a product in and of itself, not very harmful. And they're seeing it as much more socially acceptable, much more normative, much more cool to use these products. So that changing landscape really explains why we're seeing a large number of adolescents initiating or appear to be, we don't have a lot of evidence yet, but appearing to initiate with these products. If I may say two things in terms of what you were saying. One of the things I think, David, that you're bringing up is it is true in some studies that we're seeing adults who are heavy smokers try to go to e-cigarettes and either using both or going back to cigarettes. I'm not so sure that going back is because we as a public health community are demonizing e-cigarettes. I don't think we're saying much about anything around e-cigarettes. I mean, there's starting to be more. But I think they're going back to it partly because the product isn't working for them, which gets back to partly the regulation, but also gets back to the health messages that we're giving them, that it's not, there are other ways to quit that probably is more effective, and that e-cigarettes aren't doing it, and instead adults are going back to using cigarettes or using both. And we don't know what the harm effects are of dual use, which is the other concern. The third quick point I want to make is on regulation. I think part of the problem is, as David said, just the government. That's how it is. But I think that there's been so many issues with the current rule in that they have the current 2009 Act, Tobacco Control Act, which does not cover e-cigarettes, but they're getting so many lawsuits, so many roadblocks at that, just on that I think it is slowing the process of the e-cigarette piece as well. Just whether it's fear, whether it's slow, whether it's politics, probably all of the above. But I think part of the connection is to the 2009 Act that has been so slow to implement.
Rob mentioned gateway, and I wonder, David, if you would talk about it, reflect on that. E-cigarettes is a gateway to tobacco use. What do we know, and what are the gaps?
Sure. And so in terms of what's being said, there is quite a bit of agreement, I think, among the three of us. In particular, and I'll get to gateway in a second, but I just wanted to respond. I agree that prudent regulation will actually take care of some of the problems that you mentioned. I think some of those flavors, particularly the butter and cinnamon flavors, are toxic. And even though you might only generate, quote, 2 or 3 toxins compared to the 4,000 and the 60 carcinogens in cigarettes, that's still harmful. And even if they're at lower levels, kids shouldn't be using them. They should be taken off the market. Regulation absolutely could take care of that, and we could have confidence that the cigarettes on the market all are dramatically less harmful, satisfying, and can help smokers either switch completely, ultimately, or quit. And so I still think we have to keep our eye on the prize. The overwhelming deaths are from lethal combustible smoke, and e-cigarettes can help while keeping them away from kids and making them as safe as possible through regulation. In terms of gateway, I don't think the gateway hypothesis is provable because it's a counterfactual. You have to assume if cigarettes didn't exist, would the kids that are largely experimenting, by the way, and almost none of them, thank heavens, are progressing to regular use. When you talk about the scary figures of 13 to 17% of kids, it's at least once in the past 30 days. If you look at the latest NYTS data of more than that. You're talking about less than 2 or 3% of kids using them more than a few days a week, a month. And those kids, 75 to 80%, are also smoking cigarettes. So the fact that we're getting more rapid reduction in combustible lethal use among adolescents than in the last 3 years, we got almost a 20% plummet in cigarette use in the last year, more rapid than in the prior years, where e-cigarette use went up dramatically. That could be a sign that it's a gateway out, not a gateway in, but we really don't know. I agree with you. I wouldn't want to make a hypothesis in either direction from the correlational studies that have been done, because there is no causality here, and it's equally plausible that they're a gateway in, a gateway out, or having very little effect. But the one thing that's true is in both adults and kids, smoking has gone down more rapidly in the last 2 years, where it's been flat prior to that among adults. The latest National Health Interview survey shows an astounding drop in cigarette use in the first 4 months of this quarter. And what might explain that? So we've got to be very careful to find the balance to maximize the benefits of a dramatically less harmful product compared to combustibles, which kill most of the people, not compared to nothing, while minimizing kids. When you go to the gateway, I hold, and I think most science has come to this conclusion, that we talk about something called the common liability model, which is vulnerable kids are prone to risk-taking, exploring, trying to get around authority, thrill-seeking, and you can't stop some of them from trying and being curious. And we're probably talking about 30, 40, or 50% of most kids, because we see over 40% of kids using alcohol under age 18, over 25% using marijuana, and the total use of all tobacco products, particularly little cigars, cigarillos, which, by the way, are flavored, as well as menthol cigarettes. 57% of kids start with menthol, because that does help the poison go down more mildly. And if we really have strong evidence, it's to ban menthol in regular cigarettes immediately, as well as restrict appealing flavors in all tobacco products, but particularly combustibles. And I'm fine with banning all flavors in all products, including e-cigarettes, to prevent attraction to kids. But I think the kids who start with e-cigarettes, it's just convenience, not a gateway. They are the vulnerable kids, and if anything, it's a marker that they're at risk for alcohol use, risky sex, or marijuana or cigarette use. They travel together. I think we've got to deal with realistically helping vulnerable kids in general and not demonizing e-cigarettes, although certainly we should keep them away from kids and make sure they know they're not harmless.
Bonnie, you want to jump in?
I just want to jump in on the part of the youth. So, you're absolutely right that we're seeing this dramatic decrease in cigarette use, and where it's coming from, I don't know. But I would challenge you a little bit and challenge our thinking in the coupling of all these risk behaviors, because over the past few years, the youth who are using tobacco, and largely cigarettes is how it was measured, are not necessarily those, or I should say the opposite, those who are having unprotected sex or sex in general in high school and using alcohol were not necessarily those who were using tobacco. That the tobacco, you could say the other way, sure, but the tobacco was a particularly high-risk group of young people. We're now seeing early evidence. The problem is we don't know a lot, but we are seeing early evidence that those who were never, and you ask them, would you ever, or do you have intentions, who never would have used or never intended on using a tobacco product, when you ask them what about e-cigarettes, they do have intentions. They're more susceptible to it. Whether that's because of the flavors or whether that's the marketing, I mean, we can conjure up a lot, or think of a lot of different hypotheses there, probably a lot of it, but that early evidence, and some of the work that we've done in our lab early evidence that the new initiates of e-cigarettes are not necessarily the same group who either are engaging in all kinds of risk behaviors or who would have necessarily went on to use cigarettes. So I think that we have a lot of work to do there, but I think that we can be creative in really trying to tease apart who are those who are going on to use e-cigarettes who may not have used combustible before and who think and say to us, those are awful, I never would do that. But e-cigarettes are a different story.
Rob, you want to jump in?
Yeah, so this is debate. I'm going to disagree on some points about youth. You know, the typical model of how young people get hooked lifetime on smoking is that initiation of smoking is part of adolescent rebellion. And they begin because they want to look cool and they want to feel older than they are. They get hooked on the nicotine, and then they have a lifetime of nicotine addiction, which historically they've satisfied with cigarettes because of their chemistry and all is most satisfying to them. We'll touch on that. My concern is we're seeing substantial rises in kids using. How many of them will become regular users and nicotine addicted is hard to tell. There's a very important transition happening now that you should know about. The initial devices called cig-alikes were small tubes about the size and shape of cigarettes. They didn't put a lot of vapor. Their chemistry wasn't right to get a real high spike of serum nicotine very quickly. Most of that market is quickly going over to advanced personal vaporizers, also known as mods, which are tank systems that put out huge clouds. And in fact, there's a recent study from the UK showing that the 36 milligram percent nicotine liquids actually give more rapid rise of nicotine in the bloodstream than a concomitant number of puffs of cigarettes, despite billions of dollars in research by tobacco companies to freebase the nicotine and get that throat hit for the established smoker. So this gets down into what happens, you know, when people get hooked on nicotine with these cigs. You know, we know that most kids, especially older kids, use multiple tobacco products. They have to satisfy it. And this is why it's not only federal regulation, it's local ordinances. Unless you make the place of use, which we now restrict for cigarettes in many ways, you can't smoke in a school or the workplace. If we're more liberal in the place of use for e-cigarettes, we're actually fighting and making people more addicted, and we're not fighting against people who are deeply addicted beginning to withdraw and stop. The reason for that is that discontinuities of nicotine dose help heavily addicted people to stop. When we became smoke-free, and I want to call Phil Pizzo out here on campus, Phil and I had people calling us saying, I've always wanted to quit, but it's now so inconvenient, thank you, because it helped me to quit. And I did quit. So the problem is with, if the place of use rules are not the same for cigarettes and e-cigarettes, what will happen is, and what is happening, people will vape at their desk, they'll vape in places that they can't. They will continue to identify with the smokers. And when they're in a place they can smoke, they'll go back to their combustible cigarettes. So if you look at the data on heavy smokers using e-cigarettes to quit, it is not rosy. Okay, it's still uncertain. There aren't great studies, but there have been about 5 studies in the last year that have come out. Some of them suggest a mild effect, that is to say, if you look at patches, they're probably 3 or 4%, gums maybe 5 or 6. So the good studies are showing e-cigarettes at maybe 6 or 7%. That gain of a few percent is certainly worthwhile with e-cigarettes. However, there are many other studies that show, turning that around, established smokers dual-using vapor products are less likely to quit. And there have been a number of studies that show that the odds ratio for quitting is diminished if you mix e-cigarettes in. You simply go on using both products. Now, perhaps there's a fractional harm reduction if you have less combustible and you switch to more vapor. But it is not necessarily, and the jury is out, whether these are good cessation products, even for the motivated 2-pack-a-day Camel smoker who wishes to quit.
David, do you want to respond to that?
Yeah, a couple of things. So first, we totally agree on minimizing use of e-cigarettes in environments and match that with cigarettes. We don't want kids or adults to have easy access to nicotine because ultimately, even for harm minimization, the ideal is to get people to stop using everything. The reason I'm using the word minimization rather than reduction is minimization means drive to zero. Meaning the ideal is if you switch to an e-cigarette, we want you to do it as fast as you can, but we don't know the time frame from dual use to exclusive use as the very least.
Right.
But I don't think we can dictate. I'm a clinician who's treated addictive people for many, many years. You need to give people some space and freedom to dual use, to get their brains acclimatized to weaning off the most lethal, appealing, and toxic cigarette. But ultimately, they need to know they maximize their health benefits if they exclusively move at some point to either e-cigarettes or FDA-approved NRTs, which clearly are ideal and where there's more evidence, for the rest of their life, if necessary, if it prevents relapse. So I'm fine with that, and agree that we should restrict e-cigarettes along with cigarettes. Where I disagree is on a couple of areas. One is we've got to be really careful. While nicotine addiction is problematic and nicotine dependence is problematic, it's absolutely clear that an addiction to nicotine decoupled from toxic smoke is probably not as harmful as we are making out here. And while, again, we don't want kids to use any form of nicotine delivery, frankly, if my grandkids started smoking cigarettes at age 17 or 18 and said to me, "Grandpa, what about these e-cigarettes? Should I switch or not?" I would say, if you're already using cigarettes, I'd rather you stopped using everything, and I'm going to do everything in my power to convince you that you shouldn't be using nicotine or alcohol or marijuana. But if you are, you know, we don't tell, what we say to kids is we'd rather you don't have sex at all. But if you do, please use a condom. Why can't we say that?
And don't smoke after.
And don't smoke after. But we don't go on and on that 2% of condoms fail, and therefore you shouldn't use them. So condoms are not completely safe either.
Yeah.
So let's be careful again to keep the balance and keep your eye on the prize. Public Health England is an august body, like the NIH, that did a very comprehensive review of cessation. And we have also written a very strong review and submitted it to the FDA, where we make it very clear that almost all of the studies of the negative correlation between ever e-cigarette use or sometime e-cigarette use and negative smoking cessation are all uninterpretable because of selection bias. We've got 90 randomized trials of NRTs showing that they double or triple the success rate of quitting. Around 20% to 23% is the average. But there are 3 studies very similar to these 10 or 15 e-cigarette observational studies that suggest that when NRT is used in, quote, real-world settings, it doesn't work at all. So this clearly, Saul Schiffman and others have written very carefully about the fact that if you don't measure the exposure to the treatment adequately, and if you have selection bias called diagnosis bias, which is that the people who are desperate and having the hardest time quitting are going to try the new products out of desperation because they can't quit. And so when you have these 2 selection biases operating, it's almost impossible not to get a negative correlation in any observational study. So we have 2 randomized trials and 1 really prominent study by Bina and Hartgrave that actually measured how much you used the e-cigarette. So 2 things. One is, if you say, have you ever tried an aspirin ever in your life? And you answer yes. And then you say, do you get headaches in the last 30 days? And you say yes. There's going to be a negative correlation that aspirin don't help you with headaches. That's what almost all of those observational studies are like. And I testified at the FDA to this in June, that 15 or 20 observational studies that are fatally flawed in their methodology doesn't increase the robustness of a misleading finding.
I think Rob wants to jump in.
I just wanted to follow up on that, and from my marketing perspective, what is happening in the market of e-cigarettes, if you go to a gas station or convenience store, is that it's the major tobacco companies are taking over the shelf space. The leading brand in America right now is Vuse, Altria, Marlboro. That's what they make. And if I were Marlboro and I were Altria and I was thinking about this, and I believe this is their behavior, they want their Marlboro smokers, where all their profit lives in combustible tobacco. There's almost no profit, and it's probably expense still on the electronic cigarettes for them. They would love to see that market die. And so they've created a product in Vuse that the heavy Marlboro smoker will try, because they're going to see it in supermarkets. And when they go to try these products, find it unsatisfying, because it is a small cig-alike product that don't satisfy the heavy smoker, and return to their Marlboro saying this is junk. So in the real world, what are people getting exposed to? What are they picking up when they try? Because, again, the tobacco industry working on profit, you would hope that they would choose to be a bit like Coca-Cola. They have Coca-Cola regular with diabetes and obesity, and then they'd have Coke Light with other problems, maybe less so. But in fact, they really are trying to support regulations that put the perhaps 500 US marketeers of electronic cigarette products out of business by creating very high standards of purity and regulation, which are actually good in many ways. They want to take it over, manage it, and kill it, because it's all a business question. And I think that in the end of the day, consumers won't have necessarily the choices we wish them to have, which are high enough concentration nicotine delivered chemically in a way to satisfy their addiction the way that their current cigarettes do, so that they will eventually cease.
Bonnie, you want to jump in first?
Just two quick points on that. The other thing that we're seeing, and it is early evidence, unfortunately, as is a lot of the things that we're talking about, but early evidence that, one, that adult former smokers who are exposed to marketing for particularly the cig-alikes of e-cigarettes, it cues them, or whatever word you want to use, but that we're seeing some early evidence that adult former smokers are going back to using cigarettes, that they're seeing it. The other pieces for young people is when they look, and we've done this in some of our qualitative studies, when you ask adolescents, what does this look like, and you show them a product of a cig-alike, they think it's a cigarette, not an e-cigarette. And so, in the early evidence, and one of the things I think that we also have to look at that really gets into the regulation that I think we all agree on a lot of ways of this. I think our disagreements are more on the optimism side than I think, and to what extent we should be regulating than they necessarily are on some of the other issues. But I think that we need to be really careful, both for youth and for adults, on the side of the marketing and what cues are being given when anybody looks at something that is supposedly an e-cigarette next to a cigarette, and are they interpreting that as a cigarette or not, and how is that then promoting their likelihood of use?
Mm-hmm. So a couple of thoughts about this, and again, I think unfortunately we have sparse science, so some of this is more driven by our ideologies, which it would be probably a good thing to make your ideology explicit rather than implicit and have it bias our statements. So I'm clearly a harm reductionist, but remember, harm reduction's first principle is complete, I'm really a harm minimization person, is complete abstinence is the ideal. But if you can't do that, reduce harm by using classes of products with the least harm. And that's the same as the recommendation we make to kids about risky sex. We'd rather you didn't do it, but if you're doing it, please use protection. So given that, a couple of things. One is, I worry very much about the same thing you do. Big tobacco getting into this is a real problem. And them muscling out alternative companies that are trying to put them out of business is a disaster.
Or buying them.
Or buying them. And of course that's their strategy. They make money on everything. The joke I used to say is, if Weight Watchers bought Dunkin' Donuts and put both stores next to each other, they'd make money on the revolving cycle of generating obesity and then treating obesity. So big tobacco is a worry.
Yeah.
But here's my solution, and the only thing I think we can do. If we agree with big tobacco that e-cigarettes don't help you quit, that they don't work very well, and we support the warning labels that Reynolds and PMI and Altria have put. I mean, why are they putting these big warning labels on e-cigarettes, on Vuse, that say, warning, this can cause blood pressure increase, diabetes, cardiovascular? It's like, we wish they'd put them on their lethal cigarettes voluntarily. So clearly I agree with you. What's going on here? They actually don't want e-cigarettes to be a safe alternative.
Right.
What's our solution? The more innovative companies that are not funded by big tobacco ought to be helped and incentivized. The better e-cigarette delivery systems, second generation and mod, which by the way are quite expensive and unlikely to get to most youth, which is a good thing, are the products that adult cessation people, if they're persistent, they usually try cigalikes and they fail. And unfortunately, some of the adults then say, oh, well, it was a magic bullet. I thought it would help me quit. It isn't. I guess I'm doomed to be a smoker. That's very sad. Because the Bina and Hartgrave study says that if you stick with an e-cigarette every day for 30 days, you are 6 times more likely to quit smoking, and many of them 2 years later in her longitudinal follow-up quit everything. That's consistent with the 2 randomized trials that have been done that show roughly a 20 to 23% quit rate for e-cigarettes. And the study from New Zealand the randomized trial from New Zealand is most interesting because when you use the 6-month treatment outcome criteria used by the Public Health Handbook by Fiore et al., which is in the Cochrane meta-analysis, and that is 6-month, 7-day point prevalence abstinence, not 1-year continuous abstinence, you get 23% with e-cigarettes and 16% with NRT, no significant difference. So you now have several observational studies, and I haven't even mentioned the new UK studies, and there's actually 3 or 4 under review, that show clearly that most people who dual use eventually switch to e-cigarettes, which is a huge harm reduction benefit. And all of this shows me that the evidence is quite strong that if you use the right kind of e-cigarette with good nicotine delivery, a mod, and you use it for a month or more, you're 6 times more likely to quit. And Bina actually has a negative correlation between those that used it only a few times and gave it up. And so she actually shows the response bias in all those 16 other studies. In other words, if you just try it once or twice and you're not serious, you're going to have a negative correlation. If you try it for a month or more and you're serious about finding an e-cigarette that works for you, it can be as good or better than NRT and help. In fact, I've seen data recently that in the US, it's helped 2.4 million smokers who couldn't quit to now quit. And maybe part of that rapid reduction in smoking cessation that we cannot explain in any other way, in my
Rob wants to
opinion.
jump in. So.
Yeah. I am very concerned about something we haven't touched on much, and that is advertising and marketing. So if you look at how cigarettes were traditionally marketed and how e-cigarettes are marketed, where are they predominantly marketed? Social media, Facebook, Tumblr, Twitter, Pinterest. Who lives there? Young people. Older generation smokers don't live there. There's a huge amount of advertising and promotional material that exists directly towards kids. You know, regulation of tobacco, originally by the FTC and advertising over the last 80 years, has constrained the ability to be on television and radio. Electronic cigarettes are on TV and radio. Celebrity endorsement, John Wayne. Well, now we've got Courtney Love and we've got Jennifer McCarthy, putting out these things. They have now giveaways and sampling that they give away in front of youthful-oriented stores like Forever 21 in New York City. They are holding social events where they get people together to get a vaping culture. So there's a vaping identity as there's a smoking identity. They are sponsoring concerts all over America where they sample and have the big trucks come up. And there are a whole series of them. You don't realize it, but it's very, very pervasive. All these playbooks come directly from tobacco. They're completely recapitulating the devices in the advertisements, the promises about health, pictures of doctors and nurses in advertisements saying you'll live a long life if you smoke that. This is a wild west without any regulation, and it cries out for regulation. Sadly, the FDA process isn't there. It may help in some claims for cessation, although what they just came out if you claim from the Sotera decision of 2010, if you claim that your e-cigarette helps you to cease smoking, that becomes regulated as a drug side of FDA, not the Center for Tobacco, which is much more onerous. They haven't enforced it because everyone and their cousin says that their e-cigarette helps you quit. But they just came out with the thing, so many ways of saying it'll help you quit, right? It's amazing. They will say, well, your alternative. They won't even say your smoking alternative. Or they say, you know, they'll say things like plan A with an X through it, plan B. Well, that plan A and plan B is obviously smoking and not, but they don't overtly say it, therefore the FDA is going to let them do it, is what we're thinking. And almost anyone can think of 100 different ways to say you're quitting, and that this is useful for quitting in the perception of the consumers seeing the advertising material. What the literal content of the ad may not be, but the plain interpretation. So there's a great deal of youth advertising. There are many flavors. The FDA deeming regulations does not allow them, in contrast to 2009, when flavored cigarettes, pina colada flavored, cocoa flavored, went away. All of a sudden, what do you see? A proliferation of flavored mini cigars all over, 7-Eleven, a million of them, with things like wine grape, which is great because an adolescent can break 2 adult taboos with a single action. You think about it. So the FDA, whole generation and maybe 2 generations of adolescents are going to go through a period with no effective regulation against youth marketing, with no effective regulation against youth-oriented flavors like, gummy bear flavor and chocolate chip cookie flavor. So I'm very worried about the lack of teeth in the deeming regulations and the fact that it's so slow to move on. Some of this can be done locally, but then the tobacco industry threatens litigation that will cost millions of dollars to a small community that just can't afford it. And they intimidate by fears of litigation and expense to deter states and municipalities from doing things they might. So I'm quite concerned that youth marketing is way off scale at the moment, and it's being very effective, and that if kids get hooked on it, they're hooked on nicotine, and where it goes, only time will tell whether it is in fact an association or will eventually lead to more dangerous substances.
Bonnie, you want to jump in?
Yeah, and to completely agree, and just want to continue on that, and I don't think this is necessarily an area that we disagree on, but to bring it forward in terms of regulation. Yeah. So in a lot of the research that we've done, when we ask adolescents, have you seen advertisements for these things, of course they say yes, and they're seeing the ads on the social media for the mods, whereas in person they're seeing them more for the cigalikes. Right. And we're starting to see, and here we don't know a lot, but we're finally, as you know, I chair the TCOR's thing for developing measures on use, and that's part of the problem, right? We don't measure use very well, but we are starting to see an increase in adolescents using the mods versus the cigalikes, and part of it is they're seeing it in the advertisements. But when you ask kids where they're seeing it, and they think that they're seeing cigarettes on TV now. When you ask them, have you ever seen a cigarette on TV, they say yes. We don't know if what they're really seeing is e-cigarettes, but that's the presumption around there. And we also ask, where have you seen an ad for something talking about the benefits versus the risks? And they're seeing tons of advertisements for benefits of these e-cigarettes as opposed to they're seeing advertisements for the risks of cigarettes. So we really do need to do something about this. And I think going back to what I was saying earlier around the cessation claims, the youth are seeing these cessation claims. Rob and I have had these conversations. Are we worried about youth seeing cessation claims? That's an adult claim. Yes, we are, because they're interpreting it, as our data show, they're interpreting it as saying, well, if it's okay for cessation, it then therefore must be okay for me to even initiate with. We don't know for sure, but that's what we're starting to see. And in our data, that's what teens are telling us, that because it's okay for mom to use as a cessation, it therefore is okay for me to use to go ahead and start it.
Let me close.
So that's where I get.
Let me close this section by asking each of you to answer one question about, we've talked about a lot of missing data, a lot of data, scientific data that's not out there today. If you could find one critical thing to understand about e-cigarettes in data that's not there today, what would it be? Rob?
I would love to see the technology evolve and its implementation so that it actually helps combustible tobacco users to quit in high numbers. And it doesn't have to be 70%. Merely getting an additional 10 or 20% would save a lot of lives and cure a lot of disease. That's the study that I think is most important. And the technology is rapidly evolving. The mods are mostly in vape stores. And there are vape stores now, there are probably 3,000 vape stores in America. That's where people pick up the juice, kind of in the Starbucks model. You take a shot of this or a shot of that.
And we haven't even talked about the quality or lack thereof, quality standards inside vaping.
You bet.
Or juice, yeah.
David?
Well, I actually don't think we need any data at all. It's common sense that we should keep all these products away from kids. We don't need to argue about gateways or data. The data are worrisome, and the marketing is particularly troublesome. We completely agree on that. What I would like to see is basically what we know today. I would like to see the truth get told to the public, which is you shouldn't market these to kids, but we have First Amendment problems there too, unfortunately.
Yeah.
But I think you also have to tell the truth that this class of nicotine delivery systems, which do not contain tobacco, are much safer than combustible cigarettes. And people today would be absolutely nuts to keep smoking cigarettes when you can get reasonably satisfying, perhaps not yet good enough, and innovation could help. So what I would like to see is both research and the public health community agree and come together on the following. The only choice we have with big tobacco is to drive a wedge between combustibles that kill most people and safe, not safe, but less harmful nicotine delivery systems. And to the degree that we tell the public the absolute truth, they will make wise choices. And we will speed the obsolescence of the defective cigarette, which the industry, I would challenge, should take off the market now that they have another way to make money. And they're not, which tells us what your concern is.
If you think they're doing that, you're smoking something else.
Exactly, exactly. But the challenge is to shame them and say to them, every other consumer product cares about its consumers. Why don't you?
You think you can shame someone who's a group that's shameless?
I think the issue is not to shame them, but to tell the public, you are stupid to keep smoking cigarettes. When if you're addicted or if you get positive effects out of nicotine, and that's research that I think we've missed, that there really are people smoking because there are very positive benefits of nicotine in intention, concentration, management of mood. It may well be one of the best medications if it were properly marketed and sold for people who need it. You don't tell people who desperately need antidepressants that they're addicted and they should stop if they have a biologic need. So there's a way to thread the research needle here to guide us to drive a wedge, to maximize the benefits of getting people off combustibles and protecting our kids. And I think research can help do that at the same time without overly demonizing them and maximizing, helping people get off combustibles.
Do you think that the gap is widening in the public health community, or do you think that it is lessening or diminishing?
I think it's going the wrong way. I think we're helping big tobacco by overblowing the harms of e-cigarettes. Understandably, because we think scaring kids is the best way to keep them off, but we're also losing the opportunity for people to switch. And I would include young adults who are just starting to get addicted and just progressing. And at the Truth Initiative, we're talking about the issue of prevescalation, meaning prevent escalation to more lethal cigarettes. And so while we strongly recommend that no kids or young adults should use any form of nicotine, whether it's in a less harmful delivery or not, we really would like to see anybody who's smoking not smoke cigarettes because they will kill you. And especially the attraction of menthol cigarettes and flavored little cigars, which I would say is as important as limiting flavors of e-cigarettes. And you can't have one without the other. You cannot have differential policy or regulation that over-regulates a safer, a less harmful product and ignores or under-regulates the most lethal by far product. So you cannot leave menthol cigarettes on the market and ban menthol in e-cigarettes.
Sure.
And we're going in that direction. I think we're a little bit distracted from the eye on the prize.
Bonnie?
I think a couple things. I do think that the public health arguments are widening, I think, right now. And somewhat unnecessarily, because I think that ultimately there isn't as much of a debate as it seems. But I think that there is some widening. But I think in terms of research, and the other piece that we really haven't talked about is the effects of nicotine and some of the other products. But that brings me to, if I were to say, I mean, even though I do research on adolescent use and attitudes, I really want more research, which is being done, but much more on the product itself and the e-juice, and a combination of the three pieces that we have only sort of touched on. The product, the device itself, the juice that goes into it, and what comes out of it. The so-called aerosol, because I'm less convinced, David, than you are that the public health message is as strong as you are making out to be. The general I disagree with, but the strength of it, because I'm not yet convinced to say you should go to this product. I'm okay with saying you could go to NRT. I'm less convinced that I would want to recommend e-cigarettes at this point, even if I think that it's probably less harmful, because we don't know. We haven't had the 20, 30 years of research out there. I'd like more research on the product itself so I can feel more comfortable about that. And then I'd also like to do research on some of the public health messages that you're saying. You know, if we say it to an adult, what influence is that having on young people and young adults? I think, well, I don't want to say less convinced than you, because I think you agree with me. I really worry. I don't think we can have an adult and a youth model. I really don't think we can have that. And I think that's where the public health gap, I think, is starting to go, is you sort of have, you know, I said at the beginning, I'm the youth person, you sort of have these two groups, and really it's a continuum.
Well, you've seen the deep schism, the debate here, and I thank the panel for their views. We're now going to take questions from the audience. Who has questions? Back in the back. Hang on, there's a microphone coming to you.
Could you address the question of harm reduction vis-a-vis secondhand smoke and particulate matter? Because it strikes me as a relative or a coworker of a smoker that e-cigarettes could be a benefit to everyone else.
I can start, but I'm sure you can chip in. You know, again, this is again part of, we need nuanced approaches, and I think one of the trouble we get into is when we go black and white. It's not kids versus adults.
Right.
You don't have a choice. We have to find a way to do both as best we can.
Right.
On secondhand vapor, there are not a lot of really good studies that are trustworthy yet. It's very clear that there's dramatically less emission because they don't burn except when you exhale. And there's fairly good studies that the exhale has some nicotine in it, probably less, way less than in a cigarette, and some other particulate matter in it, again, way less than a cigarette. So it depends. If you're a regulator, I would argue that even if it's a little bit of nicotine and some irritants in propylene glycol, that should be sufficient to say you should have the right to not have that blown in your face if you're in a restaurant or a public place, even though it may actually help smokers to switch and quit. So this is, again, one of those dilemmas. I'm on the side, and some of my harm minimization colleagues would disagree with me, that we should restrict or ban e-cigarette use in enclosed spaces just like we do tobacco, because even a little bit of nicotine, and many say it's not even strong enough to, for example, be a teratogen if it's breathed in by a pregnant mom. But here's where the precautionary principle comes in. I would rather not risk until we know for sure that it's so harmless that people can use it anywhere. So I'm on the side of saying restrict it until we know more and be conservative. Even though it's dramatically less harmful secondhand exposure than combustible cigarettes.
Robert, Bonnie?
Yeah, I would agree overall, but those of you who've seen people put an enormous cloud out of a mod, realize that there's a huge volume of exhaled gas, and in the super high nicotine versions that are often used today, there could be quite a lot. I don't think I've seen any science that looks at these that are much greater exhaled vapor than ever a regular cigarette or even a cigar would give. And if it is, most of that nicotine is not going to be absorbed. Most of it simply goes in the lungs passively and is simply shot back out into the environment. So I think there needs to be further study. But clearly, compared with smoking in a small workspace, it is lower potential with the exhaled carcinogens and tars and combustion products. One other thing, in the high power varieties with the mods, there is some formaldehyde production, which is a carcinogen, particularly where they're really heating up the vapor before it goes out. It alters the structure of the glycerin and can produce formaldehyde.
And we don't know what 20 years of breathing in heated propylene glycol is going to do, and we have no studies on that. And the other question that is the third-hand piece of it, with this enormous plume, leaving some amount on your clothing and others, as people would refer to as third-hand, that we really don't know anything about either, but there is certainly something being left behind. There are some early studies showing that, but exactly what we don't know.
Phil Piso.
So, first of all, thank you very much for the discussion. I have two very quick comments and then a question. The two comments are, first, the notion that big tobacco cares about consumers is at best Pollyannish, if not completely an oxymoron. Look at what they're doing around the world. So there's no concern, I think. The second is the fact that we would condone having people become addicted to nicotine just because it's there, to me makes no sense from a medical or public health perspective. The question is, you've talked about youth in a kind of lumped way, and I'd be interested to have a bit more granularity. What about youth from different socioeconomic backgrounds? How are they utilizing or not utilizing some of these products?
Bonnie, what do we know?
Yeah, the data are still really new there. There was some initial data, and you all may know better than I even, some initial that guys were using e-cigarettes more than girls. That's starting to level out. It doesn't seem like we're seeing as much the socioeconomic divide yet in e-cigarettes, or now, I should say. Early on, they were much more expensive. Now they're actually less expensive than cigarettes. So we're not overall. So we're not, so far, not seeing as much of the socioeconomic divide. And I don't know, at least in our data, we're not seeing an economic divide or a parental education divide as much either, because again, the parents are using these regardless of their socioeconomic status. So it doesn't seem, but it's so new, it's hard to know. We don't have a lot of big studies yet to say it.
Rob?
So this actually opens up a really interesting area that I think is highly germane, and that is the cost of use. Right? If you live in New York City where cigarettes are $15 a pack, a young person doesn't have the discretionary income, and there's a very lower level of youth initiation to combustible tobacco in New York. In California, we have low taxation. It's actually cheaper. E-cigarettes are cheaper as a way of getting nicotine dosed than are combustible tobacco as a general rule. And one of the strategies could be, you could imagine that if we taxed nicotine, and therefore you have two kinds of electronic cigarette products. Ones that maybe have sweet flavor and are colored for kids that have no nicotine. That youthful rebellion where you want to look cool with this latest gadget like the junior in high school, but there's no nicotine in it. So you can go through that vulnerable period without exiting that vulnerable period without nicotine addiction. Okay, so you imagine you have a choice between a $3 e-cigarette and a $15 e-cigarette with nicotine in it. The kids aren't going to want the nicotine. It tastes awful. It's much more expensive. And oh, by the way, it's only available in yucky tobacco flavor. So from an end game point of view, that to me makes a lot of sense.
Yeah, this is an interesting discussion. So a couple of things. I actually might agree with you on this one.
That's refreshing.
Well, we agreed on several things. Advertising,
Yeah.
keep it away from kids.
Yeah.
As you said, I think we've got to be careful that we don't get angels on a pinhead on the things we disagree with and lose the big picture.
That's right.
Which is we're trying to save lives, kids and adults, most of whom are going to die from lethal, addictive, toxic, appealing, and easily accessible combustants. So Ken Warner, Frank Chalupka, and David Sweener just published a fantastic article suggesting that we treat lower harm nicotine delivery systems differentially and try to move people who use combustibles to them. And you sort of allude to that in your comment. So I think they hit on something very important here that's a general principle, which is to make regulation and policy proportional to the degree of harm caused by the class of product, not the nicotine itself. Because if you're going to use nicotine anyway in a combusted cigarette and be highly addicted, because it's clear that's the most addictive and the most lethal form where you can't decouple the two, the smoke and the nicotine and the toxins, if an adult is going to do that anyway, I'd much rather they were addicted to clean nicotine, even for the rest of their lives. I still don't think kids should use any of it, and we should do everything we can to keep it away. But we've got to be careful that we don't go down the slippery slope of drug addiction when nicotine is probably, we don't know what the total harms of nicotine alone are separated from smoke compared to marijuana, alcohol, HIV, AIDS, risky sex, and so on. And I'll bet it's probably much lower on the total harm list if we take away the combusted smoke. That's not to say anybody should use it. It's not to say that people who are smoking shouldn't try to use it as a pathway to getting off everything, including nicotine. But I do think the organizing principle here should be, again, let's not over-demonize nicotine addiction in a clean form if it can help 44 million currently addicted smokers get off the toxins and just enjoy the nicotine. So I completely disagree with an over-medicalized model of addiction. I think this is a psychosocial and biomedical issue, and we've got to keep open minds about use of nicotine to reduce harm.
Rob?
Yeah, so I have to say that we've actually agreed on almost everything. But
Wow.
this I really disagree with you. And I really think that normalizing nicotine and making it an innocent minor addiction like caffeine is very dangerous.
I
And I'll
didn't say that.
Well, no, but that's what I hear. Let me give you my point of view. Let me give you where I'm coming
Okay.
from on this. So the FDA 2009 law gives the ability, the FDA, not to eliminate nicotine, but to manage nicotine. And one of the best end stage things, we know very well that if you give adults shredded tobacco leaf without nicotine, they get disgusted with it and quit in almost 100%. It's the nicotine that drives it, right? But they die from the smoke. Very high percentage will quit if there's no nicotine. The FDA has the authority to reduce nicotine and force alterations in its chemical bioavailability, the sort of freebasing effect that they do. That's a very potent thing. If you make nicotine out innocent, then potentially it's going to be harder for regulators to invoke that method, which is an endgame strategy.
Yeah.
Bonnie?
And for youth, I mean, you're talking again on the youth model. I mean, nicotine is very dangerous, or at least certainly not benign to an adolescent, particularly a younger adolescent in terms of their developing brain. So I also, we have this debate a lot with adolescents who come to us, and we're doing this in our intervention where they say either there's no nicotine or it's just nicotine, but I don't have to worry about it. And that we have to have that conversation with adolescents about the harms of nicotine. And I think, even Midzeller said last week that the conversation should be about nicotine. Yeah, but I don't think it's so straightforward, and I do agree, because you're also changing the social norms. If we allow anything to be used with or without nicotine, how is that then converting people to using other products, which is the other thing I worry about. But I think nicotine is something we really need to consider, and we really need to think about it for the young person.
Right. Yeah. So clearly, combustible tobacco cigarette is the most harmful, and people smoke because they love to smoke too much. And there have been plenty of trials now showing that nicotine reduction from 18 milligrams of nicotine per gram of tobacco down to 0.4 milligrams leads to increased smoking cessation, decreased toxicant loads. So my question really, what are the prospects of linking a nicotine reduction strategy with FDA deeming an appropriate regulation as an endgame strategy, politically and on the current horizon?
Yeah, I totally think that's a possibility. And to go back to a quote you made, we could have a two-pronged approach, which is to make cigarettes less appealing, ban menthol immediately,
Yes.
ban all flavors in little cigars and cigarillos, which have in fact replaced the flavor ban, especially in kids.
Yeah.
And one of the reasons total combusted use hasn't gone down very much, even though cigarette use
Right,
has,
that's right.
is because of flavored little cigars and cigarillos. And I would go with what you're saying as well. We now have a vehicle to help addicted smokers, and I'm actually particularly worried not just about low SES, but a very large portion of current smokers have mental health problems, and we don't know what the nicotine is doing. It could be helping make their psychoactive drugs work better. They may need nicotine, but again, it could be in a medicinal form like a patch or a gum. It doesn't have to be in a lethal cigarette, or it might be under regulation that we could have some approval both by CEDA on the cessation side and CTP on the consumer side to properly regulate and balance e-cigarettes to help speed a pathway out of combusted use. But couple that with perhaps making cigarettes less appealing than menthol, perhaps mandating change in pH to make them more harsh, but not harsh enough that the industry would say, in effect, you're violating the FDA because you're banning a class of products, which they cleverly had in their language. And there is perhaps a role for reducing nicotine to non-zero and non-addictive levels, as the recent studies that Eric Donnie and others in New England Journal just debated. And I was actually the chair of the scientific advisory committee of that entire trial. But I think you need both, because that trial isn't convincing that it would help people quit. They made a few more quit attempts, and they reduced their cigarettes. But I think the two together really make sense now. And in fact, this allows Mike Russell's statement, another former South African psychiatrist who 40 years ago said, people smoke for the nicotine and die from the tar, as you said. I think his dream of saying, well, maybe we could reduce the toxins in the tar, and we haven't been able to do that. The light and low tar cigarette tobacco is proof of that, with higher adenocarcinoma, more women getting deep lung cancer, etc. But he didn't have the breakthrough technology that has emerged. We have, for the first time in 120 years, since the invention of the lethal cigarette rolling machine, which is to blame for almost all the diseases that we see today, in the mass production of the single biggest, most profitable consumer product ever invented that hasn't really changed much in 120 years. We now have the opportunity to regulate and make cigarettes less appealing, toxic, and addictive, and at the same time help 40 million smokers, many of whom, probably at least 30 or 40%, say they don't ever want to quit. They like their nicotine. I would love to move them to e-cigarettes and help speed the demise of lethal combustibles. And to me, the economics of people voting with their pocketbook and their feet will force big tobacco to change its attitudes. I'm not Pollyanna-ish naive about big tobacco, but we should be pressuring them. You know, it's similar to the Ford Explorer Firestone tire issue. You've got a defective combination. They voluntarily took them off the market to avoid government crackdowns. And look at GM's disaster with the faulty ignitions. It's about time we started saying, big tobacco, you've got a defective product that kills half your users. You now have many other options. Get the damn thing off the market immediately. It's irresponsible, and you cannot justify it anymore.
Rob, you want to jump in?
Two brief comments. One is that as a physician, I can tell you that inhalation of a drug product is a very poor choice. You need to do it with asthma medicines, you do it 2 puffs a day. You don't do it hundreds of puffs in the day as you would do with this. It is just, and the FDA, I doubt, would approve inhalational nicotine given over and over and over in multiple doses throughout the day. Just a fun comment on the Bonsack machine. I disagree with you. I think what made tobacco and cigarettes was marketing genius on the part of the companies, making it essential for love and romance. The same paper-wrapped shredded leaf is masculinity and femininity. It is, if you're tired, it will wake you up. If you're anxious, it'll calm you down. It's absolutely genius.
Yeah,
And that's what made it.
Look at the Torches of Freedom issue and later getting women to smoke at the same rate as men. So actually, I'll agree with you. I think it's both and. You couldn't have what we see today without the mass-produced low-cost cigarette and the brilliant marketing of a lethal product that nobody really needed and make 40–50% of the population start with it.
And we're seeing it again with e-cigarettes.
I don't agree with that at all.
We're done. Thank you, everyone, for joining us.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.